Do you suffer from the morning stiffness in your lower back, finding it very difficult to put on the socks, putting the shoes on, leaning maybe over when you're brushing your teeth? Then when you're traveling in a car, it's kind of, the back gets quite stiff. Then it gets quite difficult actually to get out of the car, to get fully straight. You almost like feel you need to spend a little bit more time just straightening out, which should be normally absolutely without any issues. In this video, I'm going to just go over a super simple routine, something that I found super helpful for people who are suffering, who have similar symptoms. So just a short disclaimer, this routine is mainly meant to be for people who I did assess, and I found that this routine would be suitable for them. Oftentimes, when people are suffering for the similar symptoms, the difference between what is right for them and what is not so suitable for them can be very small. So oftentimes doing the same movement in slightly different way can be the difference between what makes you better and what makes you worse. But again, feel free to try this routine. It's generally very safe, but again, do it on your own risk. So first exercise is going to be very simple. You're just going to go on your hands and knees, spreading the fingers on the hands nice and wide, turning the elbow pits forward, keeping your back relatively straight. Your knees are slightly wider apart, maybe like pelvis width apart. Then the next step is going to be just going through the gentle motion, kind of rocking your lower back and forth. The goal of this is actually not to go as far as you can, but really just go over very gentle motion as far as it's pain-free. Oftentimes I found that people are able to go, let's say, downwards quite okay, but then upwards they feel like a lot of pain or a lot of stretch. Listen to your body, and even if you go from downwards position to kind of neutral and back, this is going to give you that benefit what we are after. Usually what I found is one set of 10 repetitions is actually sufficient to get some benefits from this exercise. The next step is going to be just in the same position, keeping your hip nice and straight. Almost like what I found helpful is pretend that you have your phone on your lower back. Don't try to drop it. You're going to just reach backwards with your foot just like this. What we shouldn't see is there shouldn't be any arching or kind of changing of the position of the lower back, so everything staying nice and still, and also there shouldn't be much shift side to side. If you have issues with this, I will give some kind of a little bit more specific cues, but at this, what is quite important just to do it the way there is absolutely no pain and there is very minimum movement in the lower back. What I found is there is still going to be a little bit of movement in the lower back, but what we want is just that super gentle rotation, just like this. And because the weight is over hands and knees, there is generally very little irritation, especially if the diagnosis was basically the little bit of disc bulge or disc herniation or a slip disc, whatever we want to call it doesn't really matter. And the patient or the person is fine with loading it on the hands and knees in the neutral position. These things can be very helpful. The main idea, like how or why this works, is as we sleep during the night, the disc basically get a little bit extra water in, which is being squished during the day by just the gravity. So as we lie down from this position, just like this, the discs almost like swell up, if that word would be correct. And because the disc, there is more water content, more pressure inside, any kind of disc bulge or any kind of injury to that outside layer is just making that bulge a little bit bigger. So that's why we have that little bit extra pain. But that's also that's usually also the case with the joints. Usually in the morning, first thing in the morning, we can be a little bit stiffer. Then when we get moving, it gets a little bit easier. So this is generally super safe way how to get it done without too much stretching, without too many, I guess, a risk. Hopefully you find this video helpful. Again, there is not many contraindication where I wouldn't do it, especially if the person keeps it pain-free, and if it provides you benefits that you feel better during the day, it helps you to start the day a little bit with less pain, then it's, I guess, worth investment of maybe like few minutes just into this. Generally what I recommend is one set of that cat cow, again like very very gentle, and then adding maybe 2 sets of 5 reaches each leg, and then based on the condition of that client, I usually do add 1 or 2 another exercises which help to target the specific tissues or specific movements, something what we want to work on. Again, like this is something what we do usually at the very early stage, just to get bring that pain down, so it allows a little bit extra rehabilitation, so we can build up that back, hips, whatever needs to be built up.